So let's talk about breast augmentations. This is one of the most common procedures we do, and it's an awesome procedure. So a breast augmentation is great for someone who's looking for more volume or fuller breast. That can be someone who's had children and breastfed. That can be someone that's lost some weight, or it can be someone who, just as we age, we lose volume in our tissues. Now, breast augmentation uses an implant to restore that volume. There's two main types of a breast implant. There's a saline and a silicone implant. A saline implant has a silicone shell on the outside and it's filled with saline on the inside. A silicone implant has a silicone shell on the outside and it's filled with silicone gel on the inside. Typically, I think silicone gel implants look and feel more natural. That's typically what I recommend. Sometimes in patients who are thinner, having a saline implant can cause some rippling that's undesirable. So how do we do the procedure? Typically, in a breast augmentation, we make a small incision in the crease of your breast. It's about 3 centimeters or about an inch and hides really well. Typically, I put the implant underneath the muscle and that provides some coverage and support for the implant. And it's also associated with a less risk of capsular contracture or scar tissue. The procedure is done under general anesthetic in an accredited surgery center with an anesthesia provider. Typically takes about an hour and you go home that same day. After surgery, patients might have some tightness or fullness, but typically are off any pain medication within a day or two and seem to tolerate it really well. After surgery, I see you back the next day just to make sure incisions are healing well. You'll have some follow-up appointments thereafter. After surgery, you can return to work in about a week. No strenuous activity, heavy lifting, pushing or pulling for about 6 weeks. After your surgery, you're going to be wearing a compression bra that you'll wear for 6 weeks. And it's important to remember that implants take about anywhere from 2 to 3 months to kind of settle. They have to kind of stretch out the muscle, and that swelling goes down and then kind of fall into the pocket. So it's normal for implants to ride a little high initially. There are risks of a breast augmentation, and they are low, but they do exist. It can be bleeding, infection, scars. You will have a scar, but it tends to heal really well. And then capsular contracture. That's something where scar tissue forms around the implant. It usually happens after bleeding or infection, something that causes inflammation and might require going back in and taking out that scar tissue. So a breast augmentation is a great procedure for someone who's maybe not completely satisfied with the volume of their breast or the fullness of their breast. And it can make a big difference. So it's one of our most common procedures and patients usually are very happy. So we look forward to seeing you in your consultation. If you have questions, write them down, bring them to the office. We're happy to answer them for you. We look forward to seeing you.